iba-iba ang advice ng bawat doktor sa kanilang mga pasyente when it comes to nutrition and diet. First, I want to emphasize na wala pong doktor na gustong ipahamak ang kanyang pasyente. But as humans as we are, meron po kaming biases based on our own experience and of course, the things that we believe in. When it comes to diet, iba-iba po yung advice namin. It's because iba-iba yung pangangailangan ng bawat pasyente. As an example, I will tell you my experience as a surgeon about cleft lip and palate. Yung cleft lip and palate o yung bingot po ay marami pong classifications yan. And depende po sa classifications ay iba't iba rin yung technique kung paano yan ooperahan. For example, for cleft palate alone, meron tayong more than 10 types of surgical techniques. Ito yung von Lagenbeck, Vaux-Wardell-Kilner pushback technique, yung Bardak's two-flap technique, furlough double opposing Z-plasty, two-stage palatal repair, hole-in-one repair, raw area free palatoplasty, alveolar extension palatoplasty, primary pharyngeal flap, intravelar veloplasty, vomer flap, and buccal myomucosal flap. And iba rin po yung mga technique na para sa cleft lip. And it will depend on the surgeon's experience and expertise kung ano yung mas nakasanayan niya dito at kung ano yung nakita niyang effective para sa kanya and sa kanya mga pasyente. Similarly with diet, especially para sa mga may diabetes, ay ang American Diabetes Association po ay naglabas na din ng kanilang mga recommended diet for patients with diabetes. And the managing physician, hindi lang po basta diabetologist or endocrinologist or nutritionist, but general healthcare provider can actually provide these options para piliin ng pasyente at sila mismo ang makaka-decide kung ano yung pinakamaganda para sa kanila dito. In April 19, 2019, the American Diabetes Association published these nutritional guidelines, and the types of diet that are recommended would include, first, the USDA Dietary Guidelines for Americans, Mediterranean style, meron ding vegetarian or vegan, meron ding low fat, meron ding very low fat, merong low carbohydrate diet, merong very low carbohydrate diet, merong dietary approach to stop hypertension or the DASH diet, and also meron ding paleo diet. So lahat ng ito ay pwedeng options. But when it comes to our experience, not just as a physician focusing on root cause medicine, but also as a person who grew up with a strong family of diabetes and my own father who died of diabetes complications only at the age of 56, even complying to the standard diabetic diet and consistently taking his medications and his insulin injections, we have now seen that only low-carb nutrition o yung pagkain na pinapababa yung carbohydrate intake together with nutrient-dense foods tulad ng non-starchy carbohydrates and nutritious proteins and healthy fats is the most sustainable. We will make a video about why we choose this over the others. But for now, know that this is our stand. My personal stand is I believe that for those who are maintaining on a normal diet but doesn't seem to feel like improving, then we suggest that low-carb nutrition could be an option. So, hindi namin ito ini-impose sa kung sino man, but we lay this down as an option together with other low-carb practitioners in the country wherein we emphasize lowering carbohydrates to lower the need for insulin and eventually lower the insulin resistance and make the person insulin sensitive again. And just like in operating cleft lip and palate, I also have my own favorite. I usually do the furlough double opposing Z-plasty for cleft palate, and for the lip would be the Millard technique for cleft lip. So yun lang po muna for now. I'll see you again in our next video. Stay low carb so that we all stay safe. Hello everybody! Kamusta po kayong lahat? We are now in our midweek episode and I hope you are all ready for our special episode. So magkwekwentuhan na po tayo about the
yung mga remarkable success stories when it comes to low carb nutrition and fasting. So these are usually the patients that I handled, and they are very generous enough to share with you yung kanilang stories din. So ready na ba kayo on our story? So we have lots of them are diabetics, and then maraming may hypertension, and also meron din yung iba, maraming mga ibang dinaramdam, hindi lang basta diabetes, but also we're struggling with autoimmune disease, merong may thyroid, merong may thyroid problem, merong may fatty liver, meron din pong mga yung iba na mataas yung uric acid, mataas yung liver enzymes, and many more. But I am happy to tell you na marami din po sa kanila ang gumaling na. Actually, halos lahat naman sila. Meron lang sigurong one or two who hindi talaga parang naging, I think isa lang of all of our patients, hundreds of our patients, parang isa lang ata yung hindi masyadong naging successful. And it's because we advised her to do a follow-up, and of course, no, the suggested electrolytes, especially na merong dinaramdam. And so, hindi nga bumalik for follow-up, and they ended up in emergency room kasi nag-hypocalcemia. Was it very low in calcium and potassium, kumbaga? And then, yun. But otherwise, most of our patients are doing great, and they are doing really, really well, especially yung mga mababait talaga at mga totoong mga very good patients who are really yung mga sumusunod sa ating mga instructions. So, we have different stories. So, marami, no? At least dito ngayon, no? Good PM doc, 160, 120 hypertension, but now 120, 90. So, that's already, tingnan mo noon yung diastolic blood pressure mo, at least ngayon, nasa systolic mo na lang. So, what we need to work on is your diastolic of 90. Slowly but surely, malulower pa yan into 80. So, wag natin madaliin yung katawan natin when it comes to the progress and when it comes to healing. And you guys, kung meron kayong mga success stories, feel free to tell them in our comment section para mas makita ng iba. So, marami po tayong mga nakalinyang mga good stories right now. So, I hope this episode will inspire those na nagsisimula pa lang or those na wala pa talagang sa kanilang, sabi nga natin, pinaka-target. Okay? So, yung iba, hindi ko nakuha yung kanilang mga records, no? Kasi hindi ko na save. But most of them are actually doing well, and kwentuhan ko na lang kayo, and kung hindi kayo maniwala kasi nga I know I don't have their evidence or proof, so okay lang kung huwag kayong maniwala, no problem with me, but I will share with you the story na ating mga nakikita dito. So first up, sino ba nun nandito? If you're actually part of our low-carb feasting and fasting community, makikita nyo doon, those people themselves are posting it. Sila mismo yung nag-post nito, so you can verify kung totoong sila nga. So, shout out, of course, to our beloved Eileen, no? Yung one of our loudest and bravest low-carb and fasting advocate for braving the storm para lang po ipagtanggol yung ating way of life. Eileen is actually a registered nurse. Kasi akala ng iba, si Eileen is YouTuber lang talaga. Hindi po. Eileen is actually a registered nurse, pero hindi siya yung someone na nagpapamalaki, nagbo-boost ng kanyang self-esteem, just focusing on her own achievements. But she knows what she's talking about, and that's why marami na rin po siyang natulungan. So, one of our favorites, I think kakapost lang niya ngayon. Okay? So, sabi niya, it's going to be a long post. So, actually, this was just a screenshot from our LCFF community. You can be a part of that group if hindi pa kayo part nun, and you can see there. So, sabi ni Sir, more than 20 years ago, na-diagnose siya ng type 2 diabetes, okay? And was insulin dependent for the past 10 years. Lantus 70 unit, Novolog 120 to 180 units, plus pills pa every day, and still counting before pa siya nag-practice ng ating low carb and fasting. Tapos, meron din daw siyang hypertension, may kidney na stage 3 or CKD. Yun po yung chronic kidney disease, stage 3, which is very common among patients na diabetic and may high blood na din because those are the major triggers of injury sa ating kidneys. High blood pressure and high blood glucose level. So, sabi niya, my creatinine was very high. Nasa stage 3 na nga. And I'm very nervous that early age I'm going to have dialysis. And meds taken during yung high carb days, yung insulin nga, dalawang klaseng insulin, a total of nasa 200 units in a day. Grabe, sobrang dami nun. So to think we are not just looking about the economic side or the monetary side. We are just looking at the patient alone, kung ano yung epekto nito sa kanilang katawan. Whether you have all the budget to buy it or not, the very important aspect here is to see how this approach of just depending on medicines without proper nutrition can really do so much damage. So, merong Januvia, Jardiance, Irbesartan, hydrochlorothiazide, atenolol, amlodipine, gabapentin, cyclobenzapine, aspirin, atorvastatin, CPAP machine for sleep apnea. However, March 9, 2021, 5 months ago, nag-start na po siya mag-practice ng low carb with intermittent fasting. Nung una, DIY pa lang. Siya lang po. Clean, strict food, safe list, and also did extended fasting. And by April 1, so April, May, June, July, August, naka 4th month sa rin na pala si Sir. Nagkonsulta na kami for proper implementation and protocol. And most of my lab results are normal. So, galing sa CKD, stage 3, naging normal yung kanyang creatinine. So, kung meron kayong kilala na yun nga, yung creatinine ay mataas na, sobrang taas na, those are indication of kidney injury among many others kasi meron namang ibang acute phase lang na pwedeng ma-address. But kung meron man, wala pong sinasabi nating huli na ang lahat. Hindi pa huli ang lahat. So in here, from creatinine of 1.6, naging 1.1 na lang. Okay? Yung HbA1c na 11.5. Ano yung 11.5? 11.5 nasa 207. Imagine, on average So this is average, even if you're fasting, you're sleeping, or after kumain. So 207. So you can expect na on a day-to-day basis, nagsaspike up ito. Maybe more than 300 paminsan-minsan. But, okay, from 11.5, now the HbA1c is normal and need to lower down to make it in the 2-number digit na lang. Now, I'm spending my time working out and also meron kaming ginagawang DCR protocol, dry fasting, clean fasting, and refeeding, no? Guided by us as well throughout this kind of lifestyle, partnered with discipline, determination, self-control, and support from loved ones. And ano ba dito? From my loved ones, my inflammation, yung fatty liver, yung body aches are now gone. So, wala na po talaga ngayon. And I can say I am more energetic. It has also improved my eyesight. Kasi before, meron na siyang moderate retinopathy. Now, back to normal. Tingnan nyo yun, ang galing-galing. So, most of our eye problems, diabetic retinopathy, is also because of too much glucose and to some extent, too much fructose in the blood. If you are on medical field, you try to look into the sorbitol pathway. Yun po yung pathway na kung saan nakaka-damage ng mata natin. Okay, polyol sorbitol pathway. So, I have yung moderate retinopathy. Ngayon, normal na, and was also told by optometrist, sinabihan siya ng kanyang optometrist na pwede siyang mag-visit ng once a year na lang instead of every 6 months. Okay? Kasi yun nga, mas nag-improve na talaga yung kanyang eyesight. Noon, every 6 months, pinapamonitor because on the trend, deteriorating lang ng deteriorating. Okay? So moving forward, I have a double knee replacement surgery noong 2019 and March 2020. Ngayon, nakaka 10,000 steps siya every day. Kaya nyo ba yon? I think naka 10,000 steps lang ako nung Mascara Festival dito, yung parang sinulog in Cebu. So, walang kahit anong mode of transportation kasi nga, puro street party. Doon lang ako naka-reach ng aking 10,000 steps. But otherwise, hindi ko pa nagagawa yung daily na 10,000 steps. I'm also working out by using weights and gardening kapag may free time without thinking na kaya ko na pala. Hindi na sumasakit yon. Before, konting galaw lang, masakit na at tigil ka agad ako. Hiningal at mahirap kumilos. And this is really true because kahit pa naoperahan na yan, yung mga tuhod ninyo, yung hips ninyo, o kung saan man yung inyong mga operations noon, that is very prone to inflammation if ever you have inflammation sa inyong body. Okay? So, ang importante doon, yung idea that when you lower down your inflammation, you will also lower down your pain. Ano to yung buhok ko nito? Okay. So, you also lower down your pain. So, nakikita natin na si Sir, no, sobrang ganda talaga ng kanilang story. So, this one, I am just sharing with you kung ano yung mga nakikita nating testimonials in our group. So, actually, it is a public group, no? At hindi nga namin alam, they usually just tag us, nagpapasalamat without us knowing na ganun. So, wala po sa kanilang binayaran dito. In fact, sila pa nga nagbabayad for their consultation. So, it's really real and true. The science may back it up, and we have a lot of science to back it up, but there are also some evidence na parang nag-go against dito, but of course, it will be different on a very specific basis as to kung para ba yan sa ganyang mga tao. As what you can see in our video during our first episode here, first 5 minutes of our video here, yun yung about sa diabetes video natin na para maintindihan ninyo why we are promoting low carb nutrition as compared sa iba na ayaw ng low carb but are like say for example Mediterranean o yung ibang klaseng diet, low-fat diet, vegan diet. So, iba-iba yon yung preference. So, kung hiyang ka sa vegan or vegetarian, so kung hiyang ka sa low-fat diet and you can 100% say that you are at the top of your health, wala kang kailangang ibago, wala ka nang iniinom na gamot, then by all means, ipagpatuloy nyo yan. But if you are not satisfied every year, every 3 months, yung iba nga halos every month, okay? Pwede kayong every time ay tumataas lang yung values ninyo sa inyong laboratories and also yung gamot nyo, dumadagdag na lang, then maybe something is not the best for you. Something is not really working for you. Because if it's really working for you, kahit lang pa konti-konti, we should be expecting improvement, slowly improvement. No? Going back to this Mr. No, sobrang amazing yung kanyang own transformation. So sabi nga niya, this was not an easy journey. Hindi easy, no? So but I was determined because I know that I can make myself better and realize it is never too late. We can have a fresh start every day. Okay? I want to boost my self-esteem, get better, and feeling good. So, yun naman talaga yun. Yun nga sinasabi ko sa mga pasyente. At the end of the day, after you are already used to eating this way, or kahit hindi used, mas sanay pa rin tayo sa normal diet na nakasanayan natin buong buhay natin. We usually just give a trial of 1 month sa mga pasyente. Okay? You can do it as long as you know that you are doing it right. That's why we recommend either do a proper consultation first or have a coaching session with our Lcf Master Class coaches. Marami po yan. And unfortunately, I'm going to have a study leave. So, hindi na po ako makakatanggap ng additional patients. But don't worry, we have Doc Fee, we have Doc Mike, we have Doc Lisel Ganancia, we have Doc Suzette Encarnado, we even have Doc Kim Saskia for OB concerns, at marami pa namang iba. We also have Dr. Regina Banda, we have Doc Iggy Agbayani, although alam kong very, very busy na din siya. We have Doc Brian Castillo, of course, no? And our friend, Dr. Iris Raddev. Although hindi man lahat ng kami ay available, but you can have a check kung available for those booking. And for masterclass graduates naman, just check in our page. Meron tayong list of LCF Masterclass graduates dyan. And you can choose kung sino ang mas babagay sa inyo. We have the ones prioritizing millennials, meron ding mga middle age, meron ding mga soon-to-be retirees, so, or mga mommies, or meron ding retired na. Okay? So, meron tayong coaches for all of those para mas magabayan po kayo. So, don't hesitate to ask kasi mas importante pa rin that your first month will be guided. That, yun nga sinasabi natin, if you have to do low carb, you have to do it right the first time para makita mo talaga if it will do you good or not. And after the first month, yung sinasabi ko nga sa mga pasyente is, after that, kapag alam mo na how these foods make your body feel, we will see if there are some improvements sa current practice mo. Like say, for example, additional of this kind of foods, more focus on proteins, or more focus on foods that are rich in potassium, yung mga ganon. Eventually, yung sinasabi ko, no, you no longer need to listen to me. Hindi nyo na kailangan makinig sa akin, but you will just listen to your own body, to your own self, to the signal na binibigay ng katawan nyo. Eventually, kapag nasanay na kayo with a certain amount of intermittent fasting, you no longer need to think about the time. Okay? Just listen to your body. If you feel like wala kayong gana kumain ngayon, then don't force yourself to eat. But if you feel like you really need to eat, so kahit 7 o'clock pa ng umaga, kahit sanay ka na 12 noon ka nang kumakain, then by all means, okay? You can just eat whenever you want. Basta't alam mo yung general guidelines, like say for example, it's not natural for us to eat late at night or to eat these modern day foods na puro matatamis, puro trans fat, and processed foods. So you already know of that. So at the end of the day, the patients who are practicing low carb nutrition and fasting will eventually decide kung ano yung gugustuhin nilang gagawin. Kung ipagpapatuloy ba nila or they go back to normal diet. Okay? Whatever that means, no? Kung anong normal para sa inyo. But for us, our normal actually is low carb, and there's no other way for us to go back to other diet or yung sinasabi namin high carb or our usual everyday diet, which is typically low carb. So, yung sabi ni Sir, ipagpatuloy natin, we can have a fresh start every day. I want to boost my self-esteem, get better, feeling good. I can really say that I have greatly improved. A big thanks to my mentors and of course, the admins and moderators of Life Without Rice. Hello sa lahat ng admins and moderators of Life Without Rice and LCFF community. And of course, to my family, especially sa Chief Wifey, no? Blood pressure is in normal range. I check it 2 times a day, morning and before bedtime. This is an achievement. Hindi lang ang weight loss ang goal dito. My health issues are slowly reversed and I am insulin and med-free now. So, isn't it nice? 20 years diabetic, 10 years insulin dependent, almost 200 units na wala ng insulin ngayon. And of course, no, we have to clarify, hindi po ito biglang-bilang winala. Okay? This was medically supervised, pa-konti-konti, slow weaning of medications, and this was done on a very safe method. Okay? So for example, for our blood pressure medications, hindi namin yan inaalaw na tanggalin bigla-bigla because those medications can lead to rebound hypertension. So meron tayong post dyan about the list of medications na hindi dapat bigla-biglang alisin because it can lead into harm. So this amazing person was able to do it gradually. Okay? At meron akong interesting kwento mamaya dyan. So, tapusin muna natin si Sir. So, sabi niya, a lot of us take our good health for granted and don't fully appreciate what amazing, complex, highly effective, functioning things are in our bodies are until it is too late. We get sick or old and our bodies fail us. So many people spend for their health. Let us stop this kind of practice. Let us make ourselves healthy, our health better. So, thank you so much. So, ang sabi nga, no, let's go low carb, let's get safe, and have a blessed day, everyone. 1,000% supporting low carb advocacy and fasting for healing. So, eto si Sir Rock, kasi na-post na natin to before. So, eto siya noon, Sir Jazzy, hello! I hope you are there. So, October 2020. And tingnan nyo naman siya ngayon. Yan, Nax, gwapong-gwapo, no? Sobrang gwapo yan. And of course, yan, tingnan nyo naman. Oh, sobrang fit na yan. Sobrang pogi. Japorms and Japorms pa. And good thing na pati yung asawa po ni Sir Jazzy ay kasama na rin sa low carb. And the wife is also a practicing nurse. So, hindi po sila yung walang idea sa kanilang ginagawa. Before they did this, they already have a lot of experience. That's why they became frustrated as well. Kasi nga, the typical standard diabetic diet and yung mga gamot is no longer helping them. Okay? So, that's story number 1. Okay? Pangalawa, sinong next story natin? Yan, eto. So, this is one of our LCFF superstars, okay? So, nung July 2020 ay nagkaroon siya ng pacemaker implant. So, Mommy Ruth is already 71 years old, okay? So, maybe this time 70 pa lang, no? So, eto yung picture niya noon. But when she did low carb and fasting, tingnan nyo, okay? Yung kanyang glycohemoglobin or yung kanyang blood sugar ay nasa 7 by March ba yon o April? And dun siya nagsimula lang mag-low carb. Kasi always yun sabi ng mga ng mga members natin, no? Bigla lang daw sumusulpot sa kanilang timeline yung Life Without Rice or yung low carb feasting and fasting community as if it's a sign na parang kailangan talaga nila pumasok doon. It is a free community. Libre po ang pag-participate sa ating Life Without Rice and low carb feasting and fasting community. And so, nagsimula siya ng kanyang low-carb journey. But eventually, she became part of our exclusive and paid group na Diabetes Master Class and our Lcf Master Class. And now, she is doing great. So, from 7 na HbA1c, ngayon, nasa 5.9 na lang. So, yung doktor niya, hindi po ako ha, although doktor niya rin ako, pero yung doktor niya, yung primary care physician niya in America, ay yun mismo yung nagtanggal ng kanyang gamot because she no longer needed it. Okay? Because just in 3 months, she lowered it to 5.9 and we are actually expecting to even lower it to below 5.7 in the long run. Cholesterol, contrary sa mga ibang mga records ng cholesterol na tumataas ang lahat-lahat, this one is perfect. Sobrang perfect talaga. Tingnan nyo naman, yung kanyang, nasa dito? Wala dito ata. But yung kanyang triglycerides is very low, 56 lang as compared to HDL. So, sobrang ganda po ng kanyang HDL. Mataas yung kanyang HDL. And the values are perfectly good. And yung pinaka-good news dito, she felt at her best na nung last week lang ay nanalo siya sa Pro-Am Dance Sport Competition at the age of 71. She lost, ilan ngayon? Mga 12 kilos ata, yung sabi niya, or 12 pounds. Nakalimutan ko. But she lost so much and she was able to perform her best, yun sabi, dancing on ketones because she's already fat adapted, naka-fully low carb siya, and she did her best. So, sobrang amazing po talaga. Sobrang galing, no? So, marami din nagta-testimony dito. So, tingnan natin. Kuha tayo dito. So, we have Tom Sawyer Garcia. I'm one of the living testimony of low carb and fasting. FBS before, 415. Oh my God, buti na lang po at buhay pa kayo. I'm so happy you are here right now. Now, nasa 97.9 na lang. So, isn't that amazing? HbA1c before, 14.4. Now, 5.8. My medication before is 7 meds. Now, 2 meds na lang. Exercise, low carb, and fasting. So, bravo po. Bravo. Very, very good. So, sobrang amazing po yan. And thank you, Sir Tom, for sharing your journey. So, eto no, again, we are not advising anybody na biglang kunin yung mga gamot. Of course not. There is a proper way to do that and a proper time. So, I would like to say hi to Ma'am Rosemary Villa, all the way from Italy. And meron din siyang nutrition background. And sabi niya na ngayon, always LCIF. So, yung about nutrition po kasi, the study of nutrition is just patterned in the study of medicine. Okay? So, yung difference lang, yung mga doktor, mostly, wala nang time to study about the itsy-bitsy parts of nutrition, of plating, kasi mauubos yung time namin sa pagdidiscuss yan. So usually, merong nutritionist na yun yung makakapag-dictate kung ano yung gagawin nila. Depende sa advice ng doktor. Say for example, Mediterranean diet. So dapat alam ng nutritionist kung ano yung Mediterranean diet. And then, meron din tayong, say for example, sabihin ng doktor, dapat mag-ano ka, very low fat diet. So yung nutritionist, yun yung makapagbibigay ng mga important details as to kung ano yung pagkain na available and kung ano yung ating ibibigay na plato, i-prepare in a day. So, but with low carb nutrition, it's also part of the different types of diet na pwede naman din ibigay sana ng nutritionist only if they also know what to do about it or how to go about it the right way. So, thank you. We thank you all of our mga pinakamamahal nating nutritionists and dietitians, and shout out to Doc Fee and husband Doc Mike Atencio. Si Doc Mike po is internist ha, nakatrain yan. Okay, so hindi yan basta-bastang general practitioner lang. Doc Mike Atencio is a practicing internist and at the same time with a background, also a registered dietitian nutritionist. And siya mismo natagalan nung una to be convinced to low carb because yung low carb nga is sobrang salungat sa pinopromote before on their nutrition studies. But now, nakita rin niya where it can be improved and where his knowledge about nutrition can even become better when applied to low-carb nutrition. So, thank you so much po. Hello, Ma'am Ruth. I'm so happy you are here. Marami po kayong nai-inspire ngayon. Maraming salamat po for sharing your journey. And of course, meron tayo. I'm type 2 diabetic, stage 3 CKD. I'm having insulin every night and Tragenta every day. Also medication for my iron deficiency because of CKD. Advice on how to improve my health condition. And yes, matutulungan po kayo with low carb and fasting. But of course, hindi yan basta-basta, especially in this public forum. Kasi po, yun ay kailangan talaga ng thorough analysis. Alam po ng mga pasyente namin yan. Yung sessions namin, hindi yan mabilis because we have to look into your own lifestyle, your own day-to-day. Hindi po tayo bigla-bigla nagbibigay lang, oy, mag-low carb ka ng ganyan. We have to know what are your medications, what are your current monitoring, kung ano yung hiyang ka o hindi hiyang ka. I hope you can join our 21-day Diabetes Master Class para po mas maintindihan ninyo. Kasi with our consultations, hindi natin may-explain lahat ng biochemistry, yung evolutionary science, yung macronutrients, ilang grams ng calories ang kailangan mo in a day. Mauubos yung araw natin dyan. So that's why we created the 21-day Lcf Master Class para lahat ng pasyente, they can own the knowledge after. When you own the knowledge after, kayo na po mismo magde-decide. And what you just need to do is to have a consultation and confirm if you are doing it right or not doing it right or what to do with your medications. But generally, everything is covered. That's why if wala pa kayong sakit, all the more that we encourage you to learn more about this ngayon for prevention's sake and also for prevention ng sakit ng inyong family, especially if you are the breadwinner. Kasi if you are the breadwinner, alam mo na the moment na magkakasakit yung pamilya mo, ikaw rin ang mahihirapan. Ikaw rin po ang sasagot ng lahat ng gastusin na yan. So that's why it's really better to practice prevention, preventive medicine. Prevention is always better than cure. So yung 21-day masterclass natin po is the low carb and fasting approach in lifestyle diseases tulad ng diabetes, hypertension, and many more. Okay, so next, meron pa tayo dito. Yeah, so eto yung medyo nakakatuwa. Sino kayang uunahin ko dito? Sige, girl or boy story. Sige, maghahanap muna ako ng dito. Na story dito. Meron akong isang pasyente. Wala dito yung kanyang result. Tingnan ko kung nandito yung kanyang blood result. Okay. Tingnan natin. Para mapakita ko sa inyo. Okay? I hope she is here kung nakita natin. Ay, wala ta dito. But, eto lang. Kwento ako. Meron akong pasyente na nag-follow up. So, after ilang months na ba? 2 months ata. Yung weight niya na nasa 80 kilos, 82 kilos, Ngayon, nasa 72 kilos na lang. So, that's almost 10 kilogram lost. Okay? Ay, yeah, Eileen, si Doc Suzette. Oh, yeah, I mentioned Doc Suzette pala. Yeah, Doc Suzette Encarnado is our low-carb diabetologist. Okay? So, she's based in Oman, pero she accepts online consultations din. So, maganda din po makapagpakonsulta kayo ni Doc Suzette. So, going back, meron akong isang pasyente, 82 kilos, ngayon nasa 72 kilos na lang. So, more than 10 kilos yung weight loss. She's doing well. And then, since meron siyang thyroid problem, kasi for decades na ata na umiinom siya ng levothyroxine for her thyroid hormone. Kasi meron siyang Hashimoto's disease, no? Yung autoimmune disease sa thyroid. And since it's our follow-up, nag-request ako ng list of laboratories including thyroid panel. So yung thyroid panel would be the thyroid hormones na related, thyroid panel, TSH, FT4, and kumuha kami ng thyroglobulin. Okay? Yung thyroglobulin antibody. So the presence of antibodies, okay? Ito yung part ng mga autoimmune eh. Kasi nagmumuo yung mga antibodies para atakihin yung kanyang thyroid. Okay? So, nung nakita ko yung result, yung normal, dapat below 4 lang. Pero yung result niya, nasa 200. But everything else is normal and she feels great. So, sabi namin, magsa-start kami ng elimination protocol. So, nagkwento na kami kung ano yung kanyang current na kinakain and we will see kung saan yung pwede namin mai-improve doon. And then, along the way, sinabihan niya ako, Doc, kasi nakikita ko, hindi siya worried sa 200 plus na yon na antibodies. Remember, yung normal level is nasa less than 4 lang. And then, yung kanya is nasa 200 plus. And then, yung mukha niya, parang happy. She's really looking great. Especially with the weight loss. Sabi ko nga, yung leeg, kitang-kita na. Sobrang ganda talaga. And so happy pa na kasi kasama na yung husband niya ngayon sa low carb. Tapos sinabihan niya ako, alam niyo po ba, Doc? Alam niyo po ba noon, kasi ngayon pa lang siya nakapakuha ng thyroglobulin antibodies ulit. Okay, alam niyo ba, Doc, noon, ang values is nasa 3,000 plus. Kaya pala siya happy. Kasi ngayon, nasa 200 na lang. And for me, that's a really good win, no? Sobrang ganda. Sobrang ganda. So, sabi ko, hindi mo nasabi na ganun pala kataas before. But I really believe we can even lower it down as we go through. Kasi nasa 2 or 3 months pa lang naman kami. And I hope, no, in the long run, it can even be lowered. So, it's really, really great. So, nakita natin, no, na from 3,000 plus, it now went down to just 200. So, look at that gap. And I also know someone personally na merong na-diagnose siya before, sinabihan siya na walking time bomb. Kasi sobrang taas ng kanyang blood pressure at a very young age. Sobrang bata pa niya, mataas na yung BP niya. And he has a strong family history that his dad also passed away early. Parang nasa 40s pa lang na heart attack na, and by 50s namatay na rin. And then siya at the age of 30s is sobrang taas na yung kanyang blood pressure, 200, 230, ganun kataas. And he's very athletic, very muscular yung build. So hindi may isip ng iba kung ano yung problema. So when he had his laboratories check, yung triglycerides niya ay nasa 3,700 plus. Basta yun yung upper limit na nababasa ng machine sa laboratories na yon. And when they had his blood centrifuge, halos puro taba lang yung nandun. So it's very, very high triglycerides. This is one of the things that we cover in our dyslipidemia and fatty liver master class that will start this Sunday. Okay? So ngayon, nung last na nagpa-check, before, I think it went down to around 200. But lately, pero medyo nag-lack siya sa kanyang low carb. And yung last nakita niya is nasa 500. So, of course, if you do not know the history of that person, matatakot ka sa triglyceride na 500. And of course, no, that is still troublesome kasi mataas pa rin yan. But if you know that he came from 3,700, you know that's already a really, really good improvement given na wala pang iniinom na gamot yan. And so, we are doing more adjustment para mas tuloy-tuloy yung kanyang paggaling. Okay? So, Eto, so sino na yon? Sino na? Girl. Okay, girl yung nakita kong nag-post. Okay, so the girl story. So eto yung girl story. Okay? Ito yan. I think I put it in my story, no? So, sabi ni ma'am, 4 months of LCFF, almost there. Good thing, no more insulin injections, slowly tapering my hypertension meds, and another appointment this month. So, magpa-follow up na kami this month. So, hindi pa nga kami nagpa-follow up. I think twice pa lang kami nagkita. And then, kasi yung follow-up ko sa mga pasyente, if it's not really urgent, usually after 3 months, or kung simula pa lang after 1 month, and then after 6 months, ganon. Ayoko mag-follow up ng mayat-maya. Kasi kawawa naman. That's another payment, and that's another hassle. And if you can just continue, you are doing it well, pwede na every 3 months lang muna, and if it's normal and you continue to do good, pwedeng every 6 months na lang, and eventually kahit annual na lang yung follow-up just to make sure that you're doing great. So, sabi niya, so inspired every day. I was never this healthy in my whole life. I am now at my healthiest. Thank you guys for all your selfish encouragement and limitless knowledge. You are all an angel. So shout out sa lahat ng mods and admins ng Life Without Rice and LCFF. And what's good about this this very beautiful person is insulin dependent din siya for 15 years na ba yon or 20 years, okay? And then at her 15th year of being insulin dependent, nakaka-develop siya ng certain type of leukemia, yung parang cancer sa dugo. Okay? But good thing she was able to overcome the chemotherapy and everything, and nag-okay naman siya. And then after 3 years after that, okay, nagkaroon na naman ng problem sa kanyang mata na halos nabubulag na ata, and she has to undergo a very tedious and extensive surgery sa mata just so she can save her own eyesight. So, ganun po. And yung insulin injection niya ay tuloy na tuloy pa din. And mind you, hindi siya ordinaryong tao because she is also a practicing nurse. Okay? She is in Europe, a nurse in Europe, and getting all the best medical attention and the best medical care, but never provided with a nutrition-based approach to really look into kung ano yung pwedeng ma-improve. And just few months ago, we did low carb, and sa ngayon nga, alam ko naman na siya yung mas nakakaalam with her insulin dose. Ikaw ba naman yung mag-insulin injection for 20 years? So alam mo na kung paano i-taper ito. It's just that they've never tapered it to really low level kasi nga buong buhay nila they've been eating high carbohydrate foods, and when you are eating high carbohydrate foods, you will need insulin all your life to try to lower down the symptoms, to lower down the inflammation, and of course normalize para malesen yung complications. But what we were not able to appreciate before, no, na kung kukunin lang pala yung carbohydrates, then the need for insulin will also not be there. Okay, so here, this is the girl story, and ngayon we will save the best for last. Medyo nakakatuwa yung last kasi basta, tingnan nyo na lang. So, eto yung panghuli na natin, no? Because you're already 15 minutes before we end our schedule. So, you know that my family is also practicing low-carb nutrition, and one of them would be my brother, Andrew. Meron din po siyang page, Engineer Andrew Kichua Rojo. And as a seafarer, kasi po nagtatrabaho siya bilang electrical engineer as a seafarer nga sa barko. And ngayon, since 7 or 6 years after siyang sumakay ng barko, ay nagkaroon na siya ng fatty liver, SGPT na mataas, uric acid na mataas, and those are very, very normal para sa mga seaman, okay? Para sa mga marino o marinero, okay? So, parang natanggap na lang din niya. he consulted with an internist here, and sinabihan siya na, akala mo ba healthy ka? Hindi ka healthy. Sinabihan siya na gano'n, at parang na-hurt siya noon. Kasi everyday tumatakbo yun eh. And I think kaka-finish lang niya ng half marathon run nung panahon na yon. And sinabihan ka lang bigla, akala mo healthy ka? Hindi ka healthy. Kasi nga, meron siyang findings of fatty liver. And the only thing we change is his food intake, on rice intake, and regulation of fruit intake, and pati na rin yung soft drinks and other desserts. And in 3 months time, na-reverse na yon. And now, he is helping many other seafarers, mga kapwa niya marino, para ma-improve nila yung kanilang health. And yun nga, nagko-coach niya siya sa kanila. So, meron akong isa sa kanila ay before they do coaching, kapag meron silang existing medical condition, ay nagpapa-clearance muna. So, they schedule it for clearance consultation just to check if it is safe for him to do low carb and fasting na slowly but surely. So, this is like my patient, and patient din niya, at nag-follow up sa kanya later, no? So, eto yung message, okay? So, sige lang, kukunin muna natin dito kasi baka may makita kayong pangalan dito eh. So, let's check. Okay, sige. So, sabi niya, "Good morning po, Sir Andrew. This is actually the wife of the patient, no? May urgent concern po yung asawa ko kasi yung accredited clinic ng kanilang barko, nagpa-medical po siya ngayon. Di po sila makapaniwala sa result na normal ang blood chem. Gusto po ng clearance." Okay? So, eto yung problem. Naging normal. Okay? Actually, naging very healthy yung kaniyang lab results. Yung problema ngayon is ayaw na siyang paniwalaan ng doktor na nagbibigay ng clearance doon. So, kami, nag-congratulate kami. Congrats na normal na ang lahat and all those, no? So, sir, kami din po, kasi sa history niya, 11 years back, okay? 11 years back, every year, di talaga normal yan. Ngayon lang, pang 12 years niya sa clinic na lab test result, nagka-normal lahat. Okay? Ang masaklap, sir, ayaw maniwala ng doktor na wala talaga siyang iniinom na medications. Kasi yung gamot niya during that time, when he consulted with us, is paubos na rin. Paubos na. And then, we assessed kung committed ba talaga siya na mag-improve ng kanyang lifestyle. At since sinabi niya na very committed siya to improve his lifestyle, so of course, we already started him sa program on lowering his medication slowly. And every day, minomonitor siya. That's part of the coaching process, no? Minomonitor kung ano yung kinakain niya, kung ano yung ginagawa niya. So, sa pagkonsulta niya nito ulit sa kanyang company doctor, ay wala na talaga siyang iniinom. So, ayaw po maniwala ng doktor niya na wala na siyang iniinom na medications po since June nang mag-consult kami sa inyo ni doktora. Ngayon, pinapaulit po siya ng blood chem. Ipaulitin lahat. Alam niyo ba magkano yon? And this patient, naka-standby to ng matagal kasi nga hindi siya ma-clear sa kanyang trabaho kasi meron siyang problema sa kanyang blood result. That's why he was really desperate to improve his health para makasapa na ulit sa barko, para makatrabaho na ulit. So the budget is really tight. Pero ngayon, na nagpa-laboratories na sila at normal na and still on the same laboratory agency, ay ayaw paniwalaan. Kasi daw, bakit bigla-biglang naging maayos yung inyong blood result na for the last 11 years ay hindi normal yan. At sasabihin nyo pa, wala kayong iniinom na gamot. Ganun daw yung sinabi sa kanya. So, pinaulit. So, ayaw po magbigay ng clearance nila. Pinapahanap po siya ng endo na magbibigay ng clearance. So, any advice? So, ganon. So, ayaw din nilang tanggapin yung medical certificate na binigay natin saying that the patient actually underwent close monitoring, medical supervision with his lifestyle change at yun nga ang nag-improve. So, yung nangyari is pinaulit-ulit yung kanyang laboratories. Kasi yung kanyang HbA1c noon ay nasa 10, 11. And nung June 1 month pa lang siya nag-low carb noon, after July, naging around 7 na lang. Okay? So, we know na mas bababa pa yan. So, yung ginawa ng doktor ngayon dito, kahit normal na lahat, pinaulit yung laboratories at the expense of the patient. So, pinaulit. At alam nyo ba kung ano yung result? Tingnan nyo yung result. HbA1c, 5.5. Very, very normal. Parang walang diabetic, parang walang history ng diabetes, okay? And yung kanyang, glucosuria, wala na din. Yung FBS, 83. So, sobrang normal lahat. SGPT, SGOT, yung liver enzymes, normal na din. And ano yung remark? Refer to specialty clinic, to endo, okay? Refer rin, ang rason kung bakit nire-refer, patient denies and intake of medications recently. Kasi daw nagdi-deny. And totoo naman na hindi na talaga uminom. Kasi nga, hindi na kailangan because the patient is monitoring their blood sugar on a day-to-day basis. So, alam nila when something is already too much. Okay? And yun yung mga amazing stories natin ngayon. So, kung kilala nyo ito, I can see some of you who knows this person. Okay? So, nasa sa inyo na yan. But these are not make-up stories. These are real stories. And everything that I shared with you only happened the last 2 days. Every day, ito po yung everyday naming nakikita. So, it's not miraculous. It's not surprising for us to see this because this is just how amazing our body is. Ganon po kagaling yung katawan natin only if we provide the right nutrition. Sobra po kasi nating in-underestimate yung importansya ng pagkain, yung importansya ng ating lifestyle to our health. I admit, ganon din po ako before because our training is really geared about providing medicines, okay? Maglilista ka. Yung ultimate na parang pinaka-success ng pagiging isang estudyante para maging doktor is to finally have the license to prescribe medications. And kung i-prescribe mo lang naman ay pagkain lang pala, ay dapat hindi ka na nag-doktor pa kasi kaya naman yan, hindi naman yan kailangan ng prescription, hindi naman yan kailangan ng lisensya. But now we appreciate that we are in this profession to really improve and provide more than just medications. We can maximize medications when it is really necessary. Pero hindi kailangan magbibigay ka ng gamot just because yun lang ang alam natin. We now know when to give medicines, when the medicines can wait, or when it is necessary to remove the medicines kung hindi na talaga kailangan. But we also appreciate the importance of food intake, proper nutrition, and the overall lifestyle ng isang tao. So, yun talaga yun. So, I hope you like our stories ngayon, no? Yung mga success stories natin. Marami naman sila actually. On a day-to-day basis, marami yan. So, yung iba, ngayon, coaches na in our Lcf Master Class, and they are becoming advocates themselves sa kanilang pamilya and sa kanilang community, and of course, sa kanilang mga friends and families. And hopefully, lahat po ay maging ganon. Okay? So, with medications, depending on indication, kung ano yung indication na binigay sa iyo ng inyong doktor for that medication, titingnan yan. Merong ibang medications na lifetime talaga kasi it is replacing an organ damage, or meron namang iba na pwedeng mawala. So that's why it is important for you to consult your trusted doctor. And if you are open to low carb or interested about low carb, you are also encouraged to do consultation again with our low carb doctor practitioners kasi po baka end of October pa ako makaka-clinic ulit. We are just finishing up the ones that we have this week, and after that baka sa October na ulit magre-resume yung clinic natin. And you have Doc Fee Atencio, Doc Mike Atencio, we have Dr. Lisel Ganancial, we have my friend Dr. Kim Saskia Espirito, we have Doc Suzette Encarnado, we also have Doc Iggy Agbayani, we have Doc Brian Castillo. Okay, so marami po tayo ngayong doktor that are available for you to have your consultation to guide you. And if ever na wala naman kayong current medical condition talaga, all the more that you want to start your health journey now as prevention and as possible help for your family, for your loved ones in this way of life. So, maraming salamat po. So, yes, no, contact lang po Angela Rojo or Alvin Chua Rojo for details of our masterclass. PM nyo lang po sila so that you can be updated sa kung ano yung details. So, fatty liver and dyslipidemia masterclass, magsa-start na po this Friday. This Sunday pala. This Sunday, and you can still have a chance to avail of the pre-registration rate as long as hindi pa siya nagsisimula. So, stay tuned and always remember to stay low carb, guys, para safe na safe po tayo. And as we end this episode, I would like to say thank you to each and everyone for all of your support and all of your continuous, no, na pag-cater sa ating mga, especially sa mga mods and moderators of our groups for entertaining questions in our low-carb feasting and fasting community para mas matulungan naman yung ating mga kasamahan to really improve their lifestyle. So, eto yung mga FB support groups natin. You can check them out if hindi pa. And if you are already part, you can also share this video as a starter teaser para sa mga kaibigan ninyo who are wondering kung bakit ang sexy nyo na, kung bakit bigla kayong naging blooming at bigla kayong hindi na bumibili ng gamot because you already started your way of life the right way. So invite them and share this video for more. And lastly, before we end, I will leave you yung ating video ngayon kung bakit iba-iba yung mga suggestions ng mga doktor when it comes to nutrition. Hindi po kami nagtatalo, okay? At wala pong nagsisinungaling. Pero iba-iba lang po yung experience natin and iba-iba rin po yung paniniwala natin. And it's not just about your field, no? Di porket pinag-aralan mo ay about, for example, kung sa akin, ENT, hanggang ENT lang yon. Of course not. Hindi lang po yung subspecialty ko ang makaka-define sa akin. And just like the same way na si Doc Iggy, who is subspecializing in orthopedics, ay hindi lang yon yung kaya niyang gawin. Okay? In fact, I became an ENT because I know skills-wise, kailangan ko yun ng training. But when it comes to non-surgical field, I can just always read on it. Okay? Kaya lang yan basahin. Kung kaya nga, maintindihan ng mga non-medical, no? Like Sir Alan Cura, we have Commander Jim Alagaw, we have our admin, Oledan Balleras, and of course, scientist Earl Stanley Lazo. We have Sir Marco Reyes. So, ang dami-dami po. We have Eileen, who is also a nurse, and Tito J. No? So, join our communities. If you can be part of these groups, meron po tayong LCIF, no? LCIF ni Sir Dave Aguila. Meron din po ng Kifi International, okay? Para po maging part kayo ng ating community. So, kahit anong Facebook groups ay very welcome po lahat. You can join everybody. And this Friday, I hope we'll have a guest and we will talk more about a different kind of low carb that is also very, very good, especially for those with autoimmune disease. So, maraming salamat po everybody. For now, I will leave you this video kung bakit iba-iba po yung mga sinasabi ng bawat doktor, especially sa YouTube, sa TikTok, or dito sa Facebook, kung ano yung diet na best para sa inyo. So, this is the one, and thank you, and have a good night, everybody.
Bakit iba't iba ang advice ng bawat doktor sa kanilang mga pasyente when it comes to nutrition and diet? First, I want to emphasize na wala pong doktor na gustong ipahamak ang kanyang pasyente. But as humans as we are, meron po kaming biases based on our own experience and of course, the things that we believe in. When it comes to diet, iba-iba po yung advice namin. It's because iba-iba yung pangangailangan ng bawat pasyente. As an example, I will tell you my experience as a surgeon about cleft lip and palate. Yung cleft lip and palate o yung bingot po ay marami pong classifications yan. And depende po sa classifications ay iba't iba rin yung technique kung paano yan ooperahan. For example, for cleft palate alone, meron tayong more than 10 types of surgical techniques. Ito yung von Lagenbeck, Vaux-Wardell-Kilner pushback technique, yung Bardak's two-flap technique, Furlow double opposing Z-plasty, two-stage palatal repair, hole-in-one repair, raw area free palatoplasty, alveolar extension palatoplasty, primary pharyngeal flap, intravelar veloplasty, vomer flap, and buccal myomucosal flap. And iba rin po yung mga technique na para sa cleft lip. And it will depend on the surgeon's experience and expertise kung ano yung mas nakasanayan niya dito at kung ano yung nakita niyang effective para sa kanya and sa kanyang mga pasyente. Similarly with diet, especially para sa mga may diabetes, ay ang American Diabetes Association po ay naglabas na din ng kanilang mga recommended diet for patients with diabetes. And the managing physician, hindi lang po basta diabetologist or endocrinologist or nutritionist, but general healthcare provider can actually provide these options para piliin ng pasyente at sila mismo ang makaka-decide kung ano yung pinakamaganda para sa kanila dito. In April 19, 2019, the American Diabetes Association published these nutritional guidelines, and the types of diet that are recommended would include, first, the USDA Dietary Guidelines for Americans, Mediterranean style, meron ding vegetarian or vegan, meron ding low fat, meron ding very low fat, merong low carbohydrate diet, merong very low carbohydrate diet, merong dietary approach to stop hypertension or the DASH diet, and also meron ding paleo diet. So lahat ng ito ay pwedeng options. But when it comes to our experience, not just as a physician focusing on root cause medicine, but also as a person who grew up with a strong family of diabetes and my own father who died of diabetes complications only at the age of 56, even complying to the standard diabetic diet and consistently taking his medications and his insulin injections, we have now seen that only low-carb nutrition o yung pagkain na pinapababa yung carbohydrate intake together with nutrient-dense foods tulad ng non-starchy carbohydrates and nutritious proteins and healthy fats is the most sustainable. We will make a video about why we choose this over the others. But for now, know that this is our stand. My personal stand is I believe that for those who are maintaining on a normal diet but doesn't seem to feel like improving, then we suggest that low-carb nutrition could be an option. So, hindi namin ito ini-impose sa kung sino man, but we lay this down as an option together with other low-carb practitioners in the country wherein we emphasize lowering carbohydrates to lower the need for insulin and eventually lower the insulin resistance and make the person insulin sensitive again. And just like in operating cleft lip and palate, I also have my own favorite. I usually do the Furlow double opposing Z-plasty for cleft palate, and for the lip would be the Millard technique for cleft lip. So yun lang po muna for now. I'll see you again in our next video. Stay low carb so that we all stay safe.